anytime I talk to somebody from Michigan, I have to ask them if they know Dr. Pohl now. I think that's required. Patty Olinger is with us this morning. I doubt she knows Dr. Pohl, but you never know. Let's ask her. Our conversation brought to you by Marcus Mack, a law firm representing injured people. Patty, good morning.
Good morning, and I unfortunately do not know that position.
Well, he's a vet with a really popular TV show in Michigan, and we love watching Dr. Pohl. But we love this topic, Patty, that we want to talk with you about because it's something we don't understand. This you do. You're an infectious disease specialist, executive director of the Global Biorisk Advisory Council. A study says people who wear glasses are 2 to 3 times less likely to get COVID-19, which raises a whole bunch of questions for us about shielding ourselves from the virus. And you're the person to answer that. So let's talk about that a little bit. We really don't have, as a general public, an understanding of how diseases spread, do we?
No. And those of us who've been in the field for years, I think sometimes we take it for granted that what we think of as common understanding is just something that's understood by everybody. The reality is that we've known for years that viruses, bacterial infections, think about your kids, if you've ever had kids that get pink eye, that viruses can infect, or you can get a bacterial infection in your eyes by touching your eyes. Or if someone sneezes and you get droplets that get in your eye. So we know that happens. And the thing with people wearing glasses is that, one, it keeps your hands out of your eyes. It also, if those big splatters are, when someone sneezes, there's a layer of something in between you and that splatter.
Mm-hmm. Yeah, absolutely. And when the pandemic broke out, we were told very early, I think, that people who wear contact lenses might want to consider switching to glasses just to protect themselves. It turns out that would have been pretty good advice.
Well, the contact lens issue is a different issue, and I will go back to my lab safety days. Initially a lot of folks said that if you work in a laboratory, don't wear contacts. And as time went on, we found that really wasn't the case. They needed to wear eye protection. And there wasn't really a correlation. It was just something that people thought maybe. So I'm not sure I buy into that one in particular yet, but I do believe that we need to look at, again, you go into a really crowded situation, wearing your mask is really important. Try and not touch your face. And wash your hands and hand sanitizer. And, if you're in a really busy location, going to, let's say a sporting event or a trade show or mass gathering of any kind, you might want to put some, even if they're clear lens glasses on. One, it keeps your hands out of your face, and two, it protects you from that splatter.
Yeah. Now, if we're talking about eyes specifically here, and a study that says that glasses wearers are 2 to 3 times less likely to get COVID-19. Are the eyes the only area that we should be thinking about?
Well, our eyes, nose, and mouth. It's like one of my directors, Dr. Gavin McGregor-Skinner, he says, protect your holes on your face. The eyes, nose, and mouth. And again, we're wearing those masks, so that's one way to protect us, and then the eyes as well.
Yeah. All right. So those are things to consider. At the same time, Patty, we look about us and we see people who are moving about, and our poll question on our website this week has to do with the topic as well. Once you have the vaccine, do you feel that folks should be free to move about without taking some of the precautions that we've been taking? And in our poll this week, the people say no, everybody should have the same restrictions until a vast majority of people have had the vaccine. That's 51%, while 32% say, yeah, you should be able to move about without restrictions now because you've had the vaccine. But 16% of the people say, I'm not sure. I wish there was more information to help me decide. So where do we find that information, Patty?
So that's a great question, and I'll tell you, my two sons are both residents, and they are both vaccinated. And during the vaccination process, they were told, which is the correct thing to be told, that you still need to have protection from a standpoint of wearing your mask, washing your hands. You still can become infected, but what they're finding, and this is what the hope is, also, and there's still more information to be gathered, is that the severity of the disease would be really low, as far as that mild cases, and then you may not even realize that you've been infected, but you might be able to transmit it to others still. So wearing that mask yet, washing your hands, until we have more information, then that's really important. So I'm on that camp of we still need to have precautions, and we still need to get to what's called herd immunity, meaning that a lot of us, a large percentage of us, and we're not there yet, have been vaccinated so that we can then start really relaxing some of these restrictions.
Patty Olinger is our guest. She's an infectious disease specialist. Patty, since the beginning of the pandemic and all the way, here it is, a year now since we've been talking about this, has the information changed all that much? Have you had to have any big course corrections for the way that you look at things?
It's interesting. I think from a biosafety, biorisk management standpoint, we kind of we understood just in general how to handle some things. There has been a lot of information, and we have so much access to information nowadays that it's shifted a lot over time, and it's because it was a novel virus and people were learning about it more and more. We've known for many months that, it isn't airborne, but also, we know just from a scientific standpoint that if you touch a contaminated surface, and as we just talked about, touch your eyes, that you can become infected that way as well, or, your nose and mouth. Those are really important things to understand. And it's confusing for a lot of people because they hear, oh, it's airborne, I don't have to worry about surfaces. No, that's not the case. Mm-hmm. We need to look at things. Yes, standing next to somebody who's infected and nobody is wearing a mask increases your probability of becoming infected, but these other areas need to be paid attention to as well. That's where we're starting to find that let's face it, we're all learning. And those who maybe aren't, as comfortable with science have become amazing at learning about viruses and bacteria and infectious diseases as well.
Our natural inclination is to compare it to something, and the thing that is the most likely candidate to compare coronavirus to is flu, and so we do that. But is that the most appropriate comparison, or are there others out there?
There are others out there, but the flu is a great comparison. And if you look at our numbers for the flu this year, oh my goodness, they are way down compared to previous years. And it's really because we're social distancing, we're wearing masks, we're doing those work practices or those just day-to-day life practices that we've tried to, communicate to people for years, washing our hands, for example. But we haven't been very good at actually doing those actual behaviors. Mm-hmm. We are now practicing those behaviors, and we're seeing the numbers of the flu go down. And so that's a very big side benefit to what we've been having to experience this last year.
Yeah, it's interesting. Pennsylvania's weekly flu report this year, they've not listed any cases. They say there are so few that it's not even worth counting anymore. And so every week you look at those numbers, and in the past you're adding up hundreds of cases and just nothing this year. That's the way Pennsylvania is. I'm assuming it's that way in Michigan too.
Oh, it's that way across the United States and other countries as well. And, even here in the United States, depending upon the severity of the year, you would see anywhere from 30 to 60,000 deaths every single year. And that didn't include, you got to remember, we have a 40% on average percentage of individuals who get the flu vaccine. So you have a vaccine, and you're still getting that type of death rate here in the United States, or the numbers of individuals dying. And so when you see those numbers go down, it is significant. And And that's a lesson to be learned, and it is a good correlation between, comparing those two viruses.
Patty, what's your best guess on when we do actually achieve actual herd immunity?
If we can get, as President Biden wants to have everybody, have most of the majority of the United States have access to the vaccine by the end of May, I would say we're going to start seeing some of that herd immunity this summer. We'll keep our fingers crossed.
Yeah, absolutely. Hey, this has been very, very good for me to help understand what's going on out there. What's the Global Biorisk Advisory Council? What do you folks do?
Well, this last year we've been very focused on working with facilities. We launched a GBAC STAR facility accreditation program that really works with all kinds of facilities across the world, and in their work practices for cleaning, disinfection, and what we call infection prevention measures. So that would get into the social distancing, their indoor air quality, what programs they need to be put in place, and give them that third-party accreditation or look and stamp, you might say, to say, we're ready to reopen safely and bring back our employees, our customers, our fans for sporting events, to be able to do it safely and, and bring back that trust and confidence. And we've really been busy working with facilities literally across the world and very heavily here in the United States.
Well, it is certainly a job that needs done, and you're out there doing it. Patty Olinger, thanks so much for visiting with us this morning. We appreciate that.
Oh, thank you very much, and you have a wonderful day.
Thanks, you too. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.